Hi, I'm back at ASH and I'm here to tell you about another checkpoint abstract that was presented in the same session and that was quite interesting. This was a Chinese study of the drug tislelizumab, which is an anti-PD-1 antibody that's made a little bit differently than our standard PD-1 antibodies. And this was very interesting because they looked at approximately 60 patients with relapsed Hodgkin lymphoma. Many of them had had brentuximab, none of them had had checkpoint exposure. So this was quite a pretreated population. And the standard response rate for checkpoint inhibitors in Hodgkin's is quite high, but the complete response rate is quite low. So the complete response rate for checkpoint inhibitors in the Hodgkin population ranges from 7 to 19%. You can contrast that with our data in the brentuximab, ipi, and nivo population where the CR rate was 84%. But remember, we were using a triplet combination, and here they're using a single agent PD-1. So they found out that with their checkpoint inhibitor, in a Chinese population, out of 60 patients, they had an overall response rate of 74% and a complete response rate of about 60%. So this is much higher than what we've seen with our checkpoint inhibitors in the US. I think this raises some questions about whether the difference is due to the population, whether this is a population-specific effect, or whether this is really a slightly different engineering in the checkpoint blockade molecule that is responsible for the increased activity. It's hard to know because tislelizumab has not yet been treated outside of China, but we are interested to see where this drug is going to go in the future and whether this very provocative response rate and complete response rate holds up.